Welcome to a Shot in the Arm podcast, coming to you from AIDS 2024 at the booth of the Global Listening Project here in the exhibition hall of AIDS 2024. Right, let me just show you, for those of you watching, just what this looks like. Yeah, we can see the production crew. So yeah, managed to track down Jeff Sturcio. Hey,
Hello.
Jeff, welcome back.
Yeah, good to be here.
You're looking remarkably fresh as a daisy, can I just say?
I don't know what to say to that.
Don't know what to say to that. And as many of you know, a Shot in the Arm podcast is a project of the Global Listening Project. And we're delighted to be joined by our co-founder and chair, Professor Heidi Larson. Hey, Heidi.
Hi, Ben. Happy to be here. Nice to see Jeff.
Great to see you both back. Now, Heidi, you've got a presentation here at AIDS 2024. Could you tell us why it was important for the Global Listening Project to be here, and maybe to kick it off with just a little bit of information for those very few poor souls who don't know what the Global Listening Project is?
Well, that's great. We're here, as Ben had mentioned, at the International AIDS Conference. And the talk I'm going to give is in a panel on fake news and misinformation and the AIDS response and what it can learn from COVID-19. I actually think it's a bit of the other way around, because I think the COVID response has a lot to learn from AIDS, and just here in the conference center, the nature of community and the diversity, it's really buzzing in ways that, to be honest, I haven't quite seen some other scientific conferences have such engagement at so many levels. So I'm going to be talking about that tomorrow, but really what was great was that the week kicked off with the opening of an art exhibit where in this gathering of AIDS scientists, they picked 12 of us to pair with an artist. And there's a fantastic exhibit. And in the case of my talk and work, the artist, Charles Long, makes handmade paper, and distilled from my talk that it was really about trust, distrust, but the roots of trust. So I'll open my talk tomorrow with a fantastic handmade paper image where he created roots in the soil and is talking about the roots of distrust. And the Global Listening Project is really trying to understand what are the roots of trust, who do people trust, who do they turn to, so we can be better prepared as a society for another crisis or time that we need societal cooperation, as we did for sure in AIDS, in the AIDS initial response, and certainly in COVID.
And on this booth, we've had a little mini studio where we've been inviting people to come in and sort of share their views on COVID, and we've particularly asked them. Well, I was going to suggest, why don't we ask both of you those very same questions? Maybe we start with Jeff, because they were your questions to begin with, Heidi. Right. So, Jeff, during COVID, who did you turn to for information?
Well, I turned to news outlets that I could have some confidence were actually giving accurate information. So, and then I probably spent most of my time listening to friends for advice on what to do. But then you have to realize that my friends tend to be, leading public health figures, experts in the field. So I realize that's a very skewed sample. But it's probably not that different than many people who turn to their friends and family for advice and trusted them the most. And also, in a sense, I was also asking physicians I knew, since many of my friends
Yeah.
were physicians, so I could, I felt that I could trust them. Uh, I didn't necessarily trust, any day-to-day information I saw over the airwaves. I had to. I mean, like most of us, I've curated a list of sources that I think are reliable. And that's what I looked at.
And then the second question we're asking people is, as we look forward to future pandemics, future crises, the Global Listening Project is crisis agnostic, of course.
Yes.
Who would you turn to?
Well, I think it's at least in my case, it's a similar answer. But I think and maybe I'm jumping ahead to some of the conclusions you might draw. But I think it's you have to find a way to have conversations with people about the issues that are concerning, so that it's not a question of just having sort of one-way communication by my reading the newspaper or talking to a friend who can tell me in response to a question I might be worried about what he or she thinks the answer is. But also I think it's important for experts to listen to communities and try to get a sense of what's worrying communities, and then respond to those concerns rather than it just being a one-way. It's got to be a dialogue. I think that's the conclusion I would draw.
We've had 18 people come to the booth and record things today. Heidi, given what Jeff has said and what we've heard from people, what's your take? Are you surprised? Are you encouraged? Are you concerned?
Well, no, I'm thrilled. I'm not surprised because Jeff usually has a way of mastering the information. But also, I think what you said was particularly important is people's friends have other roles in life. And also, what we should be remembering is the other side of that is policymakers also go home to friends and family and church leaders or other influencers. And you really put the context of how these different types of information and sources and for support as well as information surround us and influence each other's, because we tend to isolate pieces and not look at the holistic community. Another piece of that is you can trust a lot of sources, but what you actually decide yourself that you're going to do is at the end of the day could be very emotional. It could be very it may be against the science, but it's what you feel like you need to or want to do. But we got to start with what people trust and who they turn to. While being a lead in the Global Listening Project and the Vaccine Confidence Project, I was a lot of COVID. I was on webinars in meetings with other scientists, other researchers, but I also had a family of researchers that worked with me and my team. And I spent a lot of time, on the phone or on Zoom with them, really just, how are you doing? We would have group meetings. They all had very different experiences. They're all bright, totally dedicated to the work, and but they had a lot of concerns. They had anxieties about the vaccines. Some of them even said, I feel guilty even questioning vaccines, working for the Vaccine Confidence Project. But I got to tell you, Heidi, I'm a little uncertain. I'm a little scared. And some of them had some tough situations at home. Some of them, had different family situations. I saw some of my younger researchers and students sitting on, upside down boxes in their garage because their home situation was quite small. So one of the things of being a Zombie, being life on a Zoom so much, is we actually got to know each other's physical settings, which I thought was really certainly for me, really helped me understand the constraints that some people had, and also made me much more forgiving for some of the things that maybe weren't delivered on time, or why they weren't able to finish things. So it was really eye-opening for me.
Jeff, you've got a few questions for Heidi.
Well, I do. One of the things that we were talking about earlier is, whether we know enough about the role that communities play in helping to achieve certain public health outcomes.
Yeah.
And just to put it bluntly, it seems to me that many policymakers just ignore what we know from decades of detailed investigations in the public health community about the role that communities play.
Yeah.
And so what I think is so exciting about the Global Listening Project is that, as I understand it, you're looking at 70,000 people across 70 different countries to really understand attitudes and how people build trust. And that comes out of the global experience of the COVID pandemic. But what I think that's going to offer is the kind of quantitative data that helps some policymakers to accept that the results that may have come from more qualitative research are actually meaningful and have an impact, or should have an impact, on how they make decisions about policies, about allocation of resources, and how to prepare for the next crisis.
Yeah.
So how are you, well, first of all, what are you learning? And secondly, how are you rolling out those findings so that we can really get more people to take them into consideration as they begin to prepare for future health crises?
Thanks, Jeff. The data has been, it's a massive amount of data, and our WISE advisory board urged us to not save it until we get our, final shiny printed report, that anything could happen any day, so to size it as soon as we can. And Ben and I, separately and together, have been, along with some of our in-country colleagues, doing roundtables, starting to share the early data to get feedback, because also we want to make sure it makes sense. And to be honest, we didn't have anyone say, "Oh, that's crazy. That doesn't make sense." In fact, what it did was open a discussion where people gave us more detail why that number was what it was. What was particularly interesting to me and to us was the fact that people didn't rate or rank how well their government did based on the number of COVID cases or COVID deaths. As a public health community, we tend to rank countries in their success in COVID is how many cases they had. Did they keep the case number down? Did they keep the mortality down? From the public's perspective, that wasn't at all what they were measuring. Their assessment of how well the government response was how well they were taken care of. In what was their well-being? Were they able to get food? Were their kids able to get some kind of attention and schooling? Did they lose their job, or did the government give them some kind of support? Did the lockdown measures, were they humane? And those were the things that mattered to people. And that I think is a really important message to government, is don't just focus on the R naught number, or, flattening the curve or whatever. People have very different needs in these emergency times, and they didn't really feel like they were listened to. All over the world, we heard a similar thing. We knew we needed guidance. We knew this was an emergency. But again and again, people said, but what they were asking us was not relevant to our situation. So one big learning was listen to your people, listen to the different communities. And many of them, in the absence of relevant national or state guidance, where what I thought was just incredible during COVID, the way communities came together and came up with their own solutions, which I hope we can keep that alive.
Yeah, well, it's this reminds me of it wouldn't be an AIDS conference if there weren't demonstrations. And
Right.
on Tuesday at one of at the plenary session in the morning, there was a demonstration of members of the community wearing white coats, as
Oh,
if
yeah.
as scientists often do, and clinicians, and their theme was communities are experts.
Yeah.
And this, what reminded me of that was when you said that people felt that they weren't being asked the right questions.
Yeah.
And what that makes me think of is how so-called experts arrogate to themselves decisions about what should be investigated.
Yeah.
When in fact it's the communities who know how how a condition like COVID-19 was affecting their entire life, and they
Yeah.
wanted people to be aware of that and to help deal with it.
Yeah.
But if you were a virologist, you were asking one set of questions. If you were an epidemiologist, you were asking another set of questions. If you were somebody who was managing a health system, you had another set of questions. But they were all looking at different parts of the elephant, and nobody was actually
Yeah.
asking the community, well, what is the elephant in the room that we're ignoring?
Well, we could have our logo be the elephant actually, because that's what we're trying to do, is get a bit more of the whole picture. Another important thing we learned was how much, to the extent that it was relevant to their job, how people turn to their employers. And, some employers have huge employee bases, and some of them trusted their employer more than the government. They felt like the employer was, caring more about their needs than local government. And that was something that we didn't expect, but not that we, not that it's a crazy thing, but it was just something that I should have thought of, having, well, both of us worked in AIDS and like the role of business in the HIV response, but it's not a typical thing with vaccines, certainly. And so that was great to hear.
Yeah, well, that actually, I spent 20 years inside a large multinational pharmaceutical company, and I'm not surprised to hear that because, as you said, some companies have employee bases of hundreds of thousands,
Yeah.
if not millions. I mean, if you look at
Yeah.
a company like Walmart or,
Yeah.
there's just one example. And people spend a lot of time at their employers, right?
Yeah.
I mean, before COVID, it was all of their time. Now it's different because of hybrid working, but and as a result, because a lot of their life revolves around their employment, and and their livelihood depends on their employment. It's not surprising that they would be looking to employers for some advice.
Look, I realize the best ideas, right? We picked recording this podcast at the end of the day in the exhibition booth. And what our listeners and our viewers won't have realized is that we've had security guards stop by us twice, telling us to clear out. But before we do so, Heidi, we're generating this information because we're going to be where in September?
Well, we're going to be in New York at the Summit of the Future on the occasion of the UN General Assembly meeting, and we'll be launching. We'll probably have a series of smaller reports, but we'll be launching our first report from the massive data in a collaboration with Google, who has kindly agreed to work with us on that. And we're going to feature what the 18 to 24-year-old decade and age group was experienced, and what we learned from them in the context of broader ages, but they had a very different experience, and we'll look forward to that opportunity, and hope you stay tuned as that story unfolds. And interesting how different it was in countries by gender. It was quite a novel.
Well, I'm old school, so I was going to say I look forward to reading that report,
Yes.
but I'm sure you're going to push the information out in other ways as well.
As well. I
As
mean,
well.
you'll see that lovely report, Jeff. Well, look, with that, and what a lovely way to end the podcast, Heidi. A teaser to keep everyone interested. Just remains for me to thank you both for giving up the end of your afternoon to join us here at the booth. Thank you to Eric Espera from NewsDoc Media for recording and producing and directing this episode. Thanks, of course, to Will Lansdale, our production assistant, and to Waisha Raphael, our production coordinator. We'll be back tomorrow, hopefully without security breathing down our neck. And it just remains for me to wish you a safe day and a great day, everybody.